So welcome to this 1-hour webinar sponsored by Prevention Plus Wellness LLC, located here in beautiful St. Augustine, Florida. And my name is Dr. Chudley Wirch. I'm the president and founder at Prevention Plus Wellness. So today we've got 1 hour approximately today together we'll spend. And so I'm going to walk you through the one session SPORT, Evidence-Based Prevention Plus Wellness program for youth, which is a high school, middle school, and elementary school version, as well as the InShape PPW program for young adults. These are parallel programs. They both address primarily alcohol use prevention as well as other drugs. And of course, they all promote wellness behaviors, and we'll walk you through these programs today and the training. And then at the end of today, we'll open it up for Q&A. So if you have questions as we go along, if something's not clear, you want to make a comment about something, anything you want, this is your form as well. It's actually your form, it's not my form. I'm just sharing some things with you. So if you have questions and comments, if you have something that you want to share with others that could be helpful for them, because it is likely that we have prevention and health providers from across the nation and even abroad that are joining us today, as is typical, almost a full session. So this is one of our more popular sessions, and the SPORT, Evidence-Based Prevention Plus Wellness program, is our most popular program that is being offered in all 50 states of the nation. So let's take a look at the objectives for today's session. There's 4 of them. The first is that we'll be walking you through and giving you an opportunity to explore the contents in the SPORT and InShape Alcohol Drug Abuse Prevention Plus Wellness programs, or PPW programs. We'll look at the manuals, and again, SPORT has a high school, middle school, elementary school. We don't have time to look at them all, but I'll talk about them and compare and contrast them so you get a sense of the similarities and differences. But SPORT is for youth, high school, middle school, elementary schools. InShape is for young adults, whether that's in college or in communities or even in the military. So we're going to look at the contents of the manual. Secondly, we're going to compare the scripts for providing PPW, that's Prevention Plus Wellness programs, to participants individually as well as in a group, in person as well as online. Thirdly, we're going to review the PowerPoint slides, and I'll talk to you about the reproducible materials found in the program digital download. All Prevention Plus, well, almost all Prevention Plus Wellness programs come with a physical manual, and then which have, by the way, have the scripts for providing them to young people, and then your digital download, which includes your PowerPoint slides and all of your reproducible materials, so that you don't have to make any other purchase beyond that initial program purchase. So it is very cost effective. You don't have to buy the student materials, the youth materials, anything that you might need to evaluate the program. It's all included in your digital download. You just make copies of it. And so you can implement your programs to countless number of young people. Lastly, number 4, we're going to hop online and take a look at program implementation and evaluation training and tools and support on our website. So we're going to go through all of that. So a lot of content that we're going to be covering today, but I do want to leave plenty of time for Q&A as well. So I'll just be touching lightly on a lot of this. If you want me to drill down a little bit deeper, answer any questions you have, again, this is your form. Let's do that. So, and you can do that through the chat option. Just find your toolbar, and it has, at least mine does, has the more at the end of it with the 3 horizontal dots. You can click on that and you'll find chat, and you could type in your response and your questions. So before we go any further, why don't we launch a quick poll. I just sent it out right now. You'll be getting it in just a moment. 3 very quick questions, just to get a sense of who's online today, who's participating in the webinar. And by knowing that, we'll have a better feel for who's online and what your interests are. So when you see these 3 questions, and you'll need to scroll down to see all 3 of them, please do take a moment and participate and answer. I don't know if you could see this. There you go. Can you see that? There's my shirt today. Vote. Get the vote out. Vote November 3rd. Vote today in this Prevention Plus Wellness poll. Practice your voting skills today, and then November 3rd in the big presidential race, you can vote then too. So get prepared to vote by practicing your voting today. How do you like that? Tying it all in together. So you got 3 questions, and the questions are, number 1, which of the following PPW Prevention Plus Wellness programs are you most interested in learning about? Second, and by the way, these are all multiple choice. You can answer more than one response. Question 2, which characteristics of PPW programs do you like best or are you most interested in? And then thirdly, and then you will need to scroll down to see all the questions and the responses. What other PPW programs would you like to learn more about? All of these are multiple choice, and you could answer more than one response. So go ahead, take a minute, and please do answer these 3 brief questions. We got about half of you answering. That's about what we have, I think, in a typical presidential election. Let's see if we can do more than that. Certainly we can do better than that today. In the past, we've had as many as 8 out of 10 people vote in our little welcome poll. So let's see if we can get a little bit more than 50%. We're up to 53%. A lot of you may be on just on the audio, so you can't vote. So that may be a factor as well. So I understand that completely. So if you can vote, please do vote. I'm going to give you just another minute or so. So give everybody a chance to go through those 3 questions, so we know what your opinion is, what your attitudes, what your needs and interests are. So we got 6 out of 10 of you, 60% have voted. That's better than your typical U.S. election. So congratulations to you for voting today. And just another few more seconds to get everybody in and make sure everybody has a chance to vote. We're up to 65% of you have voted, and that's an awesome percentage. And so again, just another few more seconds. We're almost up to 70%. We've reached 70%. So 7 out of 10 of you voted. Thank you so much for participating. I'm going to stop the voting right now. We'll take a look at the responses right now. I'm sending them out to you. I'm sharing them with you, and you'll see them just in a moment. So the first question was, which of the following Prevention Plus Wellness as PPW programs are you most interested in? And sport for high school. Just so happens that that's where we're going to start today. We'll start with high school, and then I'll talk about how the high school sport differs from the middle school and the elementary school program. So we'll be talking about those programs today. You're also interested in InShape, and we'll be discussing that as well. So good for you. Thank you for that feedback. Question 2, which characteristics of PPW programs do you like the most? You like that they're evidence-based, both InShape and sport are evidence-based. And by the way, all Prevention Plus Wellness programs use an evidence-based practices, screening, and brief intervention format. So that's good. That's the number 1 thing that you are interested in, that it's evidence-based, but you're also interested in the fact that it can be provided to youth, not just in person, but online. Of course, that makes sense because of the pandemic. And then after that, other things you're interested in, single session, which makes it very practical, very feasible to provide in any setting, including online. But you're also interested in some of these other aspects of PPW programs as well. Thirdly, what other programs, PPW programs, might you be interested in? Vaping. That's the e-cigarette program. Now tomorrow, for those of you that might not know this, but tomorrow we have a webinar, same time, and I'll be walking you through, if you participate, the vaping and marijuana Prevention Plus Wellness program. Same time tomorrow. Just find that link. You can find it on our website, preventionpluswellness.com, under the news heading. And if you want, you can just drop in your email address, and you'll be on the email list for future announcements of free webinars and other resources. So most of you are interested in the vaping PPW program, followed by marijuana and opioid. And so we'll do an opioid PPW program, a webinar in the future. Other programs you're interested in, looks like all of them actually, some of you have interest in, but primarily vaping, marijuana, and opioids. So I will follow up, and we will be having opioid PPW program webinar soon. So thank you all very much for participating in the webinar and sharing with us a little bit about what you're doing. So let me make sure. I'm wondering if something may have just happened here. Let me just double check. You never know with this. Let me just double check. Right now, I'm gonna ask you, can you, because I just clicked on something, want to just double check, can you hear me at this point? Can you hear and see me? I just want to make sure if you can, you can answer. Okay, working. All right, very good. Whew. You just never know with things. So, all right, so let me go ahead and, I know I'm screen sharing the wrong screen. So let me go ahead and pull up the manual to the Sport Prevention Plus Wellness Program. We'll start there. For some reason, the manual is at the very end of the manual. There we go. So there it is. So we'll start here. I'll talk to you, give you a little bit of an overview of the Sport PPW program, high school, middle school, elementary school. I'll talk about how they differ, how they're similar, as well as the InShape program, just so that you become familiar with all the program content, the manual, the downloads, the PowerPoint slides, as well as our online resources. So this is the Sport PPW program for high school. The high school version is blue. I think the middle school version is green, and the elementary school version is red. And so you'll get this physical manual. You'll actually have a manual. And one of the key differences across these different age groups, these different developmental groups, is that you'll see different images. So you'll see different pictures. So certainly when we talk about sport and you have the Sport high school version, you'll see youth that look more of a high school or older adolescent age versus the elementary school version, which will be children. So that's one of the main differences in these three versions of programs: high school, middle school, elementary school. That said, all three versions of the Sport Prevention Plus Wellness program, the Alcohol Drug Prevention Plus Wellness program, has these 6 sections in it. So you will have an introduction, which is a great overview of the program. You will have in section 2 step-by-step directions for implementation. However, we highly recommend that if you are interested and do purchase one of our programs, that you do also consider seriously taking our 2-hour online program implementer training. It really walks you through the program step by step, and it really helps you understand the program and how to make the most of your program so you can implement it with the greatest level of fidelity and efficacy. So keep that in mind. Some organizations will purchase the programs they feel they could implement it on their own using section 2, the step-by-step directions. But in our experience, because our programs are so unique, because they're screening and brief interventions, they're motivational, designed to motivate behavior change rather than simply educate. That difference, I think, really is very unique, and that's why the training becomes essentially critical to understanding all the uses of the program and all the tools that we have, and your options for tailoring, options for collecting pre-post data and getting free analysis, and options for implementing individually or in a group, in person or online. All of that is covered during our online training. So Section 3, a screening survey and goal plan. I don't know how much of you know that how our programs work. As screening and brief interventions, there's 3 steps to implement them. First step is you screen youth for their current health habits. And the sport and the InShape programs, that is alcohol. The focus is on alcohol. It's the most prevalently used substance among young people. 6 out of 10 high school students have tried alcohol. More have used alcohol as young adults, of course. And that's why the focus is on alcohol. We have our other programs focus on other substances. Obviously, the vaping PPW program focuses on e-cigarettes, marijuana. PPW focuses on cannabis. Opioid PPW program focuses on opioid misuse and so forth. So, but these focuses on alcohol. Keep in mind that the rigorous evaluation that was conducted at SPORT, even though the focus is largely on alcohol, the outcomes also were found on tobacco use and even marijuana use. And those outcomes, some were with all youth, general youth population, and others were among substance using youth. Then the InShape program for young adults, even though the focus is largely on alcohol, the effects were for alcohol and marijuana use. So these programs are likely effective on multiple substance levels. And so, but nonetheless, we develop iterations of them or modifications of them because you, as providers, have asked us to. So if you have other needs and interests in your programming, topics, whatever, strategies, whatever you need to be successful, let us know. We listen very carefully, and because of that, we've created modifications of our Sport and InShape programs to address other substances, like I've just said, whether it be cannabis, opioids, e-cigarettes. We've expanded the use of our programs from individual use to group use to online use. We see that providers across the country and abroad are using our programs not just for the original intended use of universal prevention intervention, that's for all youth, but also as selective and indicated programs for higher risk youth, whether those youth are youth that have been screened for substance use, or in lieu of suspension in the school setting, or a behavioral or disruptive problem, whatever the case is, juvenile justice, it doesn't matter. Our programs are used in just about any conceivable setting where young people are found. That's youth as well as young adults. Anyway, to take you back, sort of got off track there. I apologize for that. So screening and brief intervention. Section 3 includes a screening survey and goal plan. Why? Because there's 3 steps to implementing our screening brief intervention. Again, step number 1, you screen youth for their current health habits. That includes in Sport and InShape alcohol, but then also wellness behaviors, particularly physical activity and sports, breakfast nutrition, sleep, even stress control. And so all PPW programs, or I should say most of them at least, integrate the prevention of substance use with the prevention of chronic disease risk behaviors, poor nutrition, lack of sleep, sedentary lifestyle, obesity, etc., by promoting the wellness behaviors. So step number 1, you screen youth for the current health habits, and includes a broad number of habits that increases awareness. Step number 3, you provide feedback. You follow your script in your manual, which you'll see in a minute. You show your PowerPoint slides. All of this content, positive image content based on the behavior image model, is designed to motivate. It's designed to cue or trigger positive images that young people have of themselves in the future, using a very image evoking terms like fit, active, successful, etc. And then 3, after that feedback, you walk them through goal setting, multiple behavior goal setting, avoid substance use, and increase protective wellness behaviors. That's a 3-step process. All prevention plus wellness programs use screening, feedback, goal setting. Our programs are, as I said, evidence-based practices, screening, and brief intervention. So they're different than other evidence-based programs, which are likely to be largely educational in nature. Section 4 has the script for providing your program individually, one-on-one. That could be individually to youth, general youth population, or high-risk youth population. And that could be in a school setting, it could be sports, it could be a physical exam, it could be juvenile justice, anywhere. It could be college campus, health center, fitness center, whatever the case might be. Individual script. Section 5, the group script, that's provided to 2 or more youth. Section 6, we now have new online remote protocols. We created those very early at the initiation of the pandemic. I think it was March, April, we had protocols, but we've expanded them. And in fact, I'll show you the resources on our website so you can use these free resources and learn more about how to provide your PPW programs online. That's online live to one youth or to a group of youth. Now in a combination situation where you may be presenting to an actual physical classroom, and as well as screening virtually to other youth at the same time, or perhaps by video, recorded video, and lastly, even by telephone. All of these protocols are on our website and are available for you. And I'll show you those today. That's section 6. Section 7, evaluation materials. This includes process materials, process evaluation for you as the instructor to assess how well you're doing, fidelity checklist, as well as a pre and post test, a pre and post evaluation that you can provide before your lesson and after your lesson. And so that you have very concrete, immediate evaluation of your lesson, your program. Very, very unique. We created this so that, because the reality is prevention specialists rarely get a sense of how well they're doing. Sometimes organizations and communities and states and regions will have, an epidemiologic survey that's done every year or biannually, but that doesn't tell you how your particular program is doing. And so what we created is a scannable pre and post test that's made to be given before the lesson and after the lesson. No need to follow up, because the measures are indicators or predictor of behavior change. And that's scannable. And we also have it on online version. So if you present your PPW program online, you could evaluate it online very, very efficiently. And we provide also free data analysis of that. More about that in a minute. And then lastly, the sport programs also have parent materials, particularly a letter to parents and 4 weekly flyers that can be handed out, mailed out, sent out, emailed, posted on your website. Why? Because we want parents to get the same, to provide the same positive image communication that you're going to provide to youth with your scripted lesson. The follow-up flyers are a second optional intervention for you, completely optional. Some organizations use it, some don't. Some use it as a follow-up to their screening brief intervention with youth. Some use it during their screening brief intervention. It's completely up to you. And when we do our online training, we give you a little bit more information as to how you can use the parent letters. And we did one study of the parent letters. They were found to be effective, significantly reducing alcohol and marijuana use among young people. So let's take a look at the whole manual. Just very quickly, there's the introduction section. By the way, again, those are the 8 sections, regardless of whether you have the high school, middle school, or elementary school version of sport. And so let's go ahead. We'll go past the introduction. This is the physical manual you'll get. Remember, you also get a digital download of all reproducible materials. Here's section 2, your step-by-step directions. We highly recommend the online 2-hour program implementer training. Here's the screening survey and the goal contract. These 2 documents are also in your digital download. So you can make copies of your screening survey. So if you're presenting the sport lesson to, let's say, a group of youth next week, there's 20 of them, you make 20 copies of your screening survey from your digital download, 20 copies of your contract, goal plan, and you're ready to go and implement it, whether that's to youth in person or online. So, so all of that is available, no additional charge. You just make copies of whatever you need, and everything is included in your program manual or digital download or our online resources. Just to give you a sense of the screening survey for the high school version of SPORT, you can see the first question asks about sports physical activities in the last year. There's a long list. It gets youth to think about and realize, by golly, I and my peers are physically active, very powerful and positive social norm message. The second question in the high school version of the sport program is, do you participate in a physical activity 30 minutes, at least 30 minutes, 4 or 5 times a week? For example, riding a bike, running, walking, swimming, etc. That's a regular physical activity message, and that question is answered very quickly with a yes or no. The high school version only has this third question, which is, your friends influence you to participate in regular physical activity. This is a social environmental message question. Remember, you're going to provide feedback on all of these screening survey questions. So this is the content for the program. This is the focus of the program. Increasing awareness, first of all, with the screening survey of that youth or those youth. And then you're going to provide feedback and positive images, cueing desired future images of themselves, engage in these wellness behaviors. 4 is a question about eating a regular healthy breakfast each morning, cereal, low-fat milk, whole wheat toast. Some examples there, they answer yes or no. The reality, by the way, for those of you that are fully aware of the annual Youth Risk Survey data across the nation, high school adolescents are not, the majority of them are not eating a healthy breakfast every day. The majority are not getting the required amount of physical activity every day. That's 1 hour is the recommended amount, 7 days a week. That's a minimum. The majority are not getting 8 or more hours of sleep. So all of these are critical chronic disease risks you're addressing, but you're also addressing them because of the positive image, motivational force associated with each of these wellness behaviors. And then you're going to get to alcohol question number 6. The past 30 days, what's the greatest number of alcoholic drinks you had at any one time, from 0 drinks to 5 or more? And so this is the high school level version. The middle school, the alcohol question is a little different. It's a staging question because we know that middle school students, young adolescents, are not as likely to be drinking, but maybe thinking about drinking. So it's a staging question. For the elementary version of sport, it's just a simple, have you ever tried alcohol, like beer and wine, yes or no? So depending on the version of the sport program, some of these questions are worded a little differently to take into account risk level and also comprehension and reading level. And then there's a question about whether you're a male or female. I'll explain that why in a minute. At the end of the intervention, at the end of the feedback, you're going to walk you through a goal plan. You're going to recommend, of course, number 4, to avoid alcohol and then all these other substances, cannabis, e-cigarettes, opioid misuse, etc., but engaging in all the wellness behaviors that you will have discussed with them already. Sleep, nutrition, regular breakfast, especially more fruits and vegetables, plenty of physical activity of every kind. And then you're going to have them pledge to avoid alcohol and drugs, identify a concrete wellness behavior to increase in terms of quantity, frequency, as well as specificity, or its measuring, sign and date it to increase motivation for change. The high school version of the sport program has some additional tips which will help increase success in this change. The goal setting is designed to increase self-regulation skills, to set goals, to monitor goals, and to help youth learn how to control their own habits, their own behaviors. And so critical to people and successful people, whether they're athletes, whether they're entrepreneurs. And self-regulation skills are so lacking in young people, particularly high-risk young kids. And then a very important concluding statement and motivational interviewing, where to post your goals, how to reset them. So the idea is to set goals to initiate behavior change and then to maintain it over time. The individual script is what you will follow if you want to implement your program to one youth at a time, either in person or online. And so all PPW programs are scripted. The beauty of the script is it doesn't matter if I implement it or you implement it or we implement it today or next year, or next 5 years from now. If you follow the script, it's going to maintain that fidelity and the reliability of that program. It makes it easier to learn. And remember, you've got the script. All you have to do is practice the script. So you become familiar with it, and then you can glance down at your manual, focus on your youth that you're providing your program to, youth or young adults, and implement your program and show your slides. And that's the beauty of the script. So the script, I think, has a lot of advantages to it, more advantages than disadvantages. And the script is literally a script you follow. There's an introduction, you show your introductory slide. So you have to figure out where you're going to project your slide. If you're presenting this to youth individually or in a group, in person or online. The slides are important because a lot of young people as adults are visual learners, so I have to address that. Plus, it's a good review and it gives them something to look at along while you're presenting this feedback about their healthy habits and unhealthy habits, wellness habits and substance use habits. So you provide that feedback and you're going to give them the script to look at. And plus, there's some images that you want them to see, largely positive images, appealing young people engage in wellness behavior. So you show the initial script, you have an introduction, you read the introduction, and then you're going to ask them to complete the screening survey. And the screening survey, again, that's step number one. It gets them to think about their own health habits, increases awareness of where they're at. And if you present this in person, you can make a copy of the screening survey, not a problem. They complete it, that increases their awareness, that's their survey, you don't need it, that's just for their awareness purposes, and then you're going to provide feedback on each of those screening survey items. If you present this online, a little bit different, you're going to walk them through the screening survey questions by showing your slides, and you're going to have them complete the screening survey on a blank sheet of paper. No problem, same thing, youth will still be able to have an opportunity to think and to participate and to reflect on their health habits, and to do so in an active way by completing a screening survey, whether it's on a form or whether it's on a blank sheet of paper. Then you're going to provide feedback. Remember that first screening survey question? It was on sports physical activity in the last year. You're going to provide feedback on that now. That's why it's highlighted in yellow. If you implement this to one youth individually, you're going to glance at how they answered their screening survey question, and then you're going to tailor their response. If they said yes, they got physical activity last year, you're going to read the yes response. Yes is green, good, go. And so you're going to show the next slides, and you're going to read the script, and the script is going to say, good for you. Sports and physical activities are a great way to get regular exercise. If they said they didn't get regular exercise in the last year, then you'll read the no response. No is in red, warning, high risk. Same slide, same content, but the feedback initially is different. It says, I see you may not be playing any sports or physical activities. You can really improve your health and how well you feel by being more active. So it's just tailored to how they responded to that screening survey question. When you present this online, no problem. You'll just show repeat the screening survey question that is shown right there in the slide, and ask them to answer verbally, and then you'll respond either yes or no. So when you present this lesson to youth individually, if you choose individual implementation, it's tailored to how they answered each of the screening survey questions. Does that make sense? If you have any questions, you can ask me in your chat option. So for example, I'll give you one more example. Under regular physical activity, this was the second question, screening survey question. If that youth answered yes, they get regular physical activity, 30 minutes, 4 or 5 times a week. You'll read the yes response. Yes again, green, good, go. And it says, I see you engage in regular physical activity. That's great. And then if they said no, you'll read the no response, which is, I see you may not get regular physical activity to feel better and to have a healthy heart and body, a healthy heart and fit body, you should get some regular physical activity. The rest of the content is the same, and let me just explain it to you. The first part of the messaging, this is a 2-part messaging system that we use. The first part is you're going to highlight the benefits, particularly cue any positive images associated with that wellness behavior. So that wellness behavior now under number 2 is regular physical activity. So you're going to show a slide and you're going to talk about all the benefits of regular physical activity, healthy heart, lung, control weight, reduce stress, a whole bunch of other benefits, increased feelings of success, reduced feelings of depression, anxiety, et cetera, et cetera. All of these benefits, including any positive images like being fit and active. Then you're going to show how alcohol and drugs in the second slide interferes with that positive behavior and images and achieving those benefits. Using too much alcohol can interfere with your fitness and your weight control by decreasing your energy level, adding empty calories to your diet. So that's the 2-step messaging process. Step 1, let me just show you another example of it. Let's say you're presenting the feedback on the question about breakfast. First slide, you're going to highlight the benefits of breakfast and any positive images that result from eating a healthy breakfast and other healthy foods, including plenty of fruits and vegetables. And then you're going to talk about how alcohol interferes with the uptake, eating nutritiously, uptake of calories and vitamins in a healthy lifestyle. That's how it works until you get to your substance use question, which was, in this case, for Sport and InShape, it's alcohol. So once you get to the alcohol question, you're going to provide more content because we're addressing more risk factors that we know research shows influence substance use, in this case, alcohol. And again, this is tailored to how they answered. Did they answer 0 beverages in the last 30 days, 1 beverage, 2, 3, 5 or more? So at the low end, if they said none, that's green, that's good, they're low risk. And so you'll read this response. If they had 5 or more, you'll read a higher risk response. But I want to just show you more slides, more content, because we're addressing other risk factors like alcohol use can cause life problems. And also, most youth do not drink, a social norm message, as well as choose for yourself and plan ahead before you are offered substances, alcohol, and recommendations for wellness. And so that's the feedback that you're going to give. And at the end of all this feedback that you're providing, it's the goal setting. And you just follow the script, and it's now take out your copy of the goal plan, and you're going to walk them through the goal plan and help them set goals to avoid alcohol and drugs and to engage in protective wellness behaviors. If you implement your program to 2 or more young people, in person or online, you'll follow the group script. Group script has the same slides, almost the same content. There's an introduction. You're going to walk your group through completing this screening survey. That's the first step of the intervention. Then the second step is you're going to provide feedback on each of those screening survey items, starting with sports and physical activities in the last year. This initial feedback is a little bit different. You're going to have them raise their hands, and you're going to go through that list of sports and physical activities, that first list in this first screening survey question. And they're going to raise their hands if you're in person. If you're online, they could respond verbally, or depending on the video conferencing format, like we've got Zoom here, There's a little hand raise option. You can have them do that. You want them to be engaged. You want them to participate. And you want them to see that, by gosh, look at my peers, my friends are all physically active. Very, very powerful and positive image. And then you'll continue the feedback. Benefits of physical activity, show the slide. Barriers or how substance use, particularly alcohol, harms physical activity. Then you show the slides, regular physical activity. What are the benefits and positive images? You read the script, show the slide to the group, whether it's in person or online. And then secondly, how alcohol and drugs interferes with regular physical activity. And you'll go through that script all the way through and then on to the goal plan. So that's it. It's all scripted. It's all very easy. Again, there is also an additional second interactive lesson that's included in your manual. If you present your program to a group in person or online, there's actually a second lesson. Other than that, most of the Prevention Plus Wellness programs are a single session. We do talk about during training how to expand that to multiple sessions, because we do realize that some of you will have access to youth for more than one lesson. So for those of you that do, we will show you how you can use your materials and your tools in your manual and online to expand to 2 sessions, 3 sessions, 6 sessions, whatever you want, whatever you need. But you can also implement your Prevention Plus Wellness program in just one brief, very powerful lesson. And we have research that shows that the effects last, some of them even a year after that single session intervention. But you can repeat or re-implement your program every 6 months, every year to your youth. It's an inoculation, if you will, a shot, not against COVID, not against flu, but against common risk behaviors that young people have in their life. Physically inactive or sedentary lifestyle, poor nutrition, not eating breakfast, not getting sleep, uncontrolled stress, and substance use. All of those are addressed in Prevention Plus Wellness, most Prevention Plus Wellness programs. Section 6 includes online protocols, and we discussed that, of course, in our 2-hour training to implement your program. And then you'll also have evaluation materials. There's a 1-page pre-test and post-test. 1-page pre-test, the post-test is a little over a page. So you've got a scannable version if you implement it in person. You've got an online version if you implement it online, your PPW program, and you'll be able to assess your program immediately, before and after. And because it's before and after, you can't measure behaviors, but what you can measure are indicators of behavior. So your first question is a measure of behavioral intentions. It's the most highly correlated and predictive measure of future behavior. Notice you're not measuring just alcohol, but you're measuring e-cigarettes, marijuana, cigarettes, and other substances, and your wellness behaviors of physical activity, nutrition, sleep, and stress control. And you're also measuring a second item, a second measure of perceived harmfulness, which is highly predictive of actual behavior use. It's negatively correlated. The more perception of harm of a substance, the less use, and vice versa. And then the post-test, exactly the same, with the exception of a couple of very, very critical open-ended items. So you get qualitative data to help fill in the gaps of your quantitative data. There's also an instructor survey, which is a self-assessment that you use after you implement the lesson to ensure that it's a high-quality lesson. And you have a fidelity checklist if you want to use that, and even a protocol to call parents if you send out the flyers. Remember that that follow-up flyer intervention, completely optional lesson. It includes a parent letter, which you can co-brand, or you can put your name, your logo on, and 4 weekly flyers that can be mailed out, handed out, sent out, emailed, posted on your website. And you're getting the parents to provide the same, hopefully, provide the same positive image communication that you provide to your youth during your screening and brief intervention. So talking to their youth about positive behaviors and positive images, and that's what these 4 flyers are like. Now, the difference is that, again, a little bit developmental difference, whether you have the high school version, the middle school version, or the elementary school version of SPORT. Let me just show you the slides the programs, just to give you a little sense of the slides. So here's the high school version slides, and the slides will cue you and the students when you present the slide. You've got your manual, you can follow your script, but the slides will also help. First part is to complete the health and fitness screening survey. And if you present this online, no problem, you'll be able to have your youth complete the survey on a blank sheet of paper. So they'll be able to assess their health habits. If you implement it in person, you'll have the screening survey, a hard copy, which you can make for everybody. And you can expand these slides so that they're, full image slides when you present this content, whether it be in person or online, as we're doing right here, for example. You got your survey questions, and then more recently, what we've done is we've built in a restatement of the screening survey questions. This really helps if you present your lesson online. And then there's a feedback, positive images. Notice the image terms, fit and strong, very, very motivational, very evocative they evoke unconscious images of themselves in the future. And then how alcohol and drugs interferes with being physically active. And there's a restatement of the second screening survey question, regular physical activity. There's the benefits. And we've built in now discussion questions. When you implement your lesson in a group, whether in person or online, this is really important to have a little bit more interaction and make sure that youth are participating. And even more importantly, to get them to continually to reflect on their own lifestyle. What types of sports or other physical activities would you like to try or do more of? You get some feedback from some of the youth, and then you continue on with your feedback. And then eventually after your feedback, you will get to recommendations for increased wellness, and then complete a goal contract. You've got two options here. You've got the hard copy, which you can show and make copies of and hand out, but there's also slides here so that you can actually present an online version of your goal plan and have your youth complete this version on a blank sheet of paper. So either whether you're presenting this in person or online, you have it all covered with your PPW program, your slides, and your manual. Now, the difference, let me show you the main difference between the SPORT program and I would say the InShape program is largely a matter of content. InShape has a little bit more content, takes a little bit longer to implement. SPORT takes anywhere from, I would say, 40 minutes, 50 minutes, depending on how much time you spend on the discussion questions and the goal plan. And then InShape is about 10 minutes longer because there's more content. Let me show you what I'm talking about here. So you can see the content. There's more content in the slides. And so that's why there's a little bit more of a script to present when you provide that feedback to your young adults. That's the InShape Prevention Plus Wellness program, a little bit more content. Okay, so I'd like to stop at this point, but I really want to, let me stop and see what questions there are. I did want to show you one other thing, but let's see what the questions are first. The only other thing I want to show you and share with you is our resources on our website. But I see that Kathy says, I could not submit my answers in the poll. I apologize for that, Kathy. I'm not sure what that was about, but thank you for trying. Will youth write things on a sheet of paper? Do they have the actual form or goal plans slide and can copy onto paper to write on? So that's addressed in a lot of different ways, Kathy. It could be a blank sheet of paper. Some organizations are actually going to the effort of getting the hard copy of the goal plan to youth in advance. Some are making it available in some other format so they can make a copy of it. That's something that you can really think about and see what you want to do. You could just have them write it on a blank sheet of paper, or somehow you could make available a version of it, either the hard copy that's provided in your program or the slide version. You can make it available to them in a hard copy or downloadable copy that they can complete while you walk them through it. Either way works fine. So you have those options, and those are great questions, Kathy, and I thank you for those. Let me see if anybody has any questions in the chat option. And let me go to the chat option. I'm going to open it up so it's a little bit easier for me to see. And here's a question that from Deb. My agency currently has and uses a sport program for high school. I am new to the agency. Can I sign up to do the 2-hour training? Yes, you can, Deb. PreventionPlusWellness.com under training. I'll show you the resources here in just a moment. Can we have a website? Can we have a writable? Can we have a writable available? I'm not sure what that means exactly. You may want to ask that question again so I can understand you, Marion. I'm not exactly sure. So while we're waiting for some more questions, let me pull up the website and show you where these resources are. Some of these resources are free for everyone. And so for that reason, I want to show you, and some are particularly designed for the users of Prevention Plus Wellness programs so that you can enhance and support and sustain your program. So here's our website. It's PreventionPlusWellness.com. This is what it looks like. This is the home page. You can point your cursor at programs and you'll see the program download if you want to learn more about programs. All of our programs are there, including our latest racial justice Prevention Plus Wellness program, which is our most unique program. And we created it because racial discrimination influences adolescent substance use. By the way, if you see this little pop-up, you see this in a lot of websites, drop your email in there and you'll be on our email list for receiving notifications for future webinars and other programs. But if you point your cursor at training, you'll see a drop down there. And the second item, I think this goes back to one of your questions, was the online program implementer training. So you can click on that for that training. Online training is $199 a person. Most of our programs are $499 a person. Now, the tools that I want to show you, by the way, we've got great news items here. If you click on news, you'll see all of our listed things that we try to post, our webinars that are coming up, even our recorded webinars, you know, resources, discounts, research, etc. But most of the resources are under the heading of tools. So if you point your cursor at tools, you've got a long list of resources, including our COVID-19 resources. So if you go to that page, for example, you'll see that we've got a recorded training. We do this live every now and then, every couple of weeks. It's on online strategies for Prevention Plus Wellness programs. It's 1 hour. You can see the slides for it. You can see our pre-test and our post-test online versions, our instructors survey online version. So there's a lot of tools there, and that's under tools and COVID resources. But you'll see a whole bunch of other things. How to promote your program is the second item. And then on the bottom, healthy lifestyle guidelines for youth and young adults. Very popular, I think perhaps one of our most popular pages on our website. And lastly, very important, check it out, PPW youth and teacher resources, a ton of resources addressing substance use and wellness behaviors for youth, as well as for you as professional prevention specialists and parents. So lots and lots of resources on our website under the heading of tools. All right, I'm going to stop at this point and see if there are any other questions and comments. I'm going back to the Q&A first. And Kathy has another comment here, and his question, is there any discussion on how the youth are supposed to store the form and the goal plans that they fill out on paper so they can retrieve it and review their responses? So that's why we prefer, and we cover this in the training, that it's really best that they have a hard copy whether that's a blank sheet and they fill it out or a hard copy that they write on, because you are going to give them instructions, Kathy, to post their goals. So it's really important that they post their goals and track them every day. So having a hard copy, really important. And if you look at the PowerPoint slides, you'll see that there's even a question there. Where are they going to post their goals? So I don't think it's necessary that they have their goals on a form per se, but that they do write them down on a sheet of paper, and that they do have somebody sign it and co-sign it, and they do post them and track them. And all of that is a part of the discussion and instruction that you'll be providing them if you follow the scripts in your manual and in the Prevention Plus Wellness program manuals, no matter what program it is, and the slides that you're given. So it's all covered, Kathy, in the program scripts and as well as on the slides. Now going back to Q&A one more time, we'll see what we have here. So we have, instead of students answering questions on a separate sheet of paper, can we have options to send them the questions on a writable sheet so they can just answer them? Yes, absolutely, Marion, absolutely. You can give them the form. So you have, Marion, in your Prevention Plus Wellness programs, whether it's SPORT and InShape, opioid, cannabis, vaping, whatever program, all of our programs have goal setting, and it comes in a Word document which you can post or give it, text it to them, mail it to them, email it to any way you want, so that they can have an actual hard copy, and that absolutely works for them. And so that's better than writing on a blank sheet of paper. But I'm talking about if you're presenting it online, you know, how are you going to get that to them? And if you can get that to them in some way and actually have a copy and then walk them through it, that's of course ideal. So that's a fantastic idea. So any way you can do that, I think that's a plus, so that they have a form upon which they can write their goals and then they can post that. All right, so any other questions or comments? We got a couple more minutes remaining. I hope I've explained everything for you. If I didn't, now is the last chance for you to respond. I want to say what I always say in my webinars to everyone. Thank you, God, for all that you guys are doing in your settings, in your communities, with your youth, with your families. God bless you for what you do. You're the prevention heroes, making a difference. Unsung heroes, undoubtedly, underpaid heroes, undoubtedly, but wonderful heroes, making a difference in the lives of young people. And thank you. If we can help in any way, let us know. We're happy to do it. It's an honor to be partnering with those of you that do decide to use any of our materials. Use our free materials, use our evidence-based, evidence-informed programs and training. Take a look at it. We've got a long list of things. Do sign up for our webinars because we have lots of good content in those webinars. Let me just double check one last time. Q&A, nothing extra there. And let me check the webinar one last time to make sure there's nothing there. Okay. Thank you so much. I'm glad you enjoyed it. I'm glad you found it useful. Again, feel free to reach out to me if there's anything I can do to help any of you. In the interim, I will follow up. I will send you all a certificate, 1 hour CEU for participating in the training, and a link to this recorded session if you want to share it with others. Have a great day, everyone. Take care of yourselves and your families, and best of luck to you during the pandemic, when I know it's very, very difficult for you. Do eat well, sleep, take care of yourselves, because your work is so critical to your regions and your areas. All right, bye everybody. Thanks for joining us. Have a great afternoon. Bye-bye.